This is really a big pet project of mine. I've been working on this for quite some time, and so I was excited that I got to present it here at iwCLL. So this is a multi-center international study, retrospective, that looks at the use of standard of care anti-CD19 directed CAR T cell therapy for Richter's transformation. So this study was based off of a previous study that myself and Dr. David Bond, a colleague of mine at OSU, performed of 9 patients who received iwCLL for Richter's transformation. And in that study, those 9 patients did remarkably well with close to 100% response rate, with one patient dying of AE, but he did actually respond if you looked at CT scans that were performed around the time. So ultimately, this led to a multi-center initiative because it is very difficult to do a Richter's transformation study, number one, and it's even more difficult when you're using anti-CD19 CAR T cell therapy, which wasn't really approved for Richter's transformation until recently. And so this was basically most of these patients probably got off-label CAR T cell therapy, but now iwCLL is actually approved for Richter's transformation because in the label, you can give it to patients who have transformed indolent lymphoma, which Richter's transformation is. So we had 7 centers and we had 55 patients, and they either received iwCLL, iwCLL, BREXACEL, or TISACEL. And it looked like the overall response rate for these 55 patients was around 61%. And the PFS and the OS were not as high as I'd hoped. For the PFS was around 4 months and the OS was around 8 months. Now, when you look at these numbers, you might say, well, CAR T cell therapy probably doesn't work for Richter's transformation. But I would argue that these patients who were included in this particular analysis were very heavily pretreated. They got around 2 lines of therapy for their Richter's transformation, and they also got around 2 prior lines of therapy for their CLL. In addition, the majority had either gotten a BTKI or VEN or both at some point during their treatment. So this group of patients were heavily pretreated, really had all of the bad prognostic signs for Richter's, and they still responded pretty well to this therapy. So I think there's still room to improve around using CAR T cell therapy for patients with Richter's transformation. I think there are a lot of new trials that are coming out that combine CAR T cells with BTKIs and various other alternative ways of boosting T cell effects. And I think that we still should pursue the use of CAR T cell for Richter's transformation, especially when there's no really other option for these patients, especially after they've already been through 2 lines for their Richter's transformation. In addition, we did a multivariable analysis to look at what predicted outcomes, and increasing lactate dehydrogenase LDH, increasing Ki-67, as well as increasing number of lines of prior therapy were all independent prognostic factors for survival for this group of patients. And so what this tells me is that we should maybe even considering using CAR T cell therapy in a earlier line of therapy than having already received 2 prior lines. So I think more work needs to be done, but I still think that CAR T cell therapy is a worthwhile endeavor to pursue for patients with Richter's transformation. And I'm excited to see the results of a few different prospective clinical trials that are currently underway. One is my trial, which is zanubrutinib plus iwCLL for Richter's transformation. There's another study of ibrutinib plus iwCLL plus nivolumab for Richter's transformation. And there's another study that is currently ongoing that is BREXACEL for Richter's transformation.